A study published this week says a can of diet soda each day raises your risk of liver disease by 60%. Sugary beverages are no better. They raise the risk of liver disease by about 50%.
9 News medical expert Dr. Payal Kohli is with us this afternoon to talk all about the study. That is a lot, 60%. So talk to us about some of these findings.
I mean, I was really alarmed because we've been telling diabetics for the longest time, go drink diet soda, right? It's better for you. I've been telling all my patients with obesity, with metabolic syndrome, the same thing. And now as a physician, I'm finally starting to get data that tells me it's maybe not so good for you. Last year, we had a study that told us that erythritol increases our risk of stroke and heart attack and may cause our blood cells to clot, and that's an artificial sweetener. So what are we to do with all this?
Well, I love a good diet.
I know you do. She
Call it a
loves
fridge cigarette. You know, you take it out, it's ice cold, it's a nice break. But why is it so bad for us? Because it tastes so good.
Well, so there's lots of reasons. So sugar makes sense, right? When you drink a can of sugary soda, it's got 10 teaspoons of sugar, causes a big spike in your blood sugar that then triggers insulin, which then makes you gain weight and all the other metabolic derangements that happen. Diet soda, it turns out, may do the same kind of thing. It triggers the same sugar circuits in the brain, so it has that same kind of addictive behavior, which is why that fridge cigarette
So good.
feels so good. Yeah. And it may trigger an insulin spike as well. On top of that, it changes what the gut microbiome, the bacteria in the gut is like. It changes the inflammation. So we think that it's just as bad. And what was really great about the study is they actually looked at 124,000 people over 10 years.
Okay.
And they looked forward. So they saw how their behaviors today were affecting what they did forward. Now, keep in mind, this was based on recall. So, Alex, if I asked you how many diet sodas have you had in the last 6 months?
You're interrogated right now.
It might be hard. It might be hard.
I do like one or two a week.
Yeah.
So I mean, it's not terrible, right?
Is there a difference between 1 or 2 a week and somebody that's drinking 3 a day?
Well, definitely there's a dose-dependent relationship, but the point I was making was that it's hard to recall exactly how much we've had. So a lot of this is what we call association, maybe not causation, because it's possible you're reaching for the diet soda because maybe you're not exercising as much, or maybe you've gained weight, or maybe you're doing something else that's also associated with this fatty liver disease, which is what we found.